High blood pressure is a common disease today. It can be the cause of dangerous complications such as cerebrovascular accident, myocardial infarction. It leaves very serious sequelae, which can lead to death for patients. Taking medication can help control hypertension effectively. This everyone knows. However, did you know natural foods can also regulate blood pressure? Number 1. Celery juice. Celery helps prevent and support the treatment of hypertension. Celery contains iron, calcium, phosphorus, rich in protein, many free amino acids, essential oils, inositol and many vitamins, helps increase appetite, stimulate blood circulation, improve the immune system and good for the brain. The natural chemical apigenin in celery helps prevent high blood pressure and helps dilate blood vessels. A 2013 study evaluated the blood pressure-lowering ability of the chemical 3N-butyl phthalate, 3NB, extracted from celery seeds. 30 people with hypertension took part in the trial. Each person consumed one capsule containing 75 mg of celery seed extract twice daily for 6 weeks. After this time, the participants all reported a significant drop in blood pressure. Number 2. Bananas. If you want to provide potassium for the body, you cannot skip bananas in your daily diet. Eating foods that are naturally rich in potassium like bananas is much better than taking supplements. Bananas are high in potassium, a mineral that plays an important role in controlling hypertension. One medium-sized banana contains about 422 mg. Potassium reduces the effects of sodium and eases tension in the walls of blood vessels. Number 3. Beetroot. Researchers have shown that the health of people with high blood pressure is significantly improved after drinking beet juice. In addition, the nitrate component in beetroot juice can help lower blood pressure in just 24 hours. In this study, people who drank 1 cup of beet juice per day had an average drop in blood pressure of about 0.8 of a millimeter Hg. For many people, this change has brought their blood pressure within the normal range. On average, a single blood pressure medication lowers levels by 0.9 of a millimeter Hg. Number 4. Berries such as strawberries, blueberries, raspberry. Berries, especially blueberries, are rich in a natural compound called flavonoids. One study found that consuming flavonoids can prevent high blood pressure and lower blood pressure. Berries such as raspberries, strawberries to add to the daily nutritional menu. If you have a family member with high blood pressure, you should prepare these berries and use them as an easy-to-eat, nutritious dessert for the whole family. Number 5. Salmon and other fatty fish. According to nutritionists, fatty fish is an excellent source of omega-3, which is beneficial for the heart. These fats may help lower blood pressure by reducing inflammation and lowering levels of compounds constriction of blood vessels, called oxylipin. One study in 2036 healthy people found that those with the highest blood levels of omega-3 fats, who had lower systolic and diastolic blood pressure than those with the lowest blood levels of omega-3s. Higher omega-3 intake has also been associated with a reduced risk of high blood pressure. Number 6. Tomatoes. Tomatoes are a food with many health benefits. For people with high blood pressure, using tomatoes can help control blood pressure and protect heart health. The reason tomatoes are beneficial for patients with hypertension is because tomatoes have high levels of lycopene and vitamin E, potassium. Have antioxidant effects, help slow the progression of atherosclerosis, reduce bad cholesterol and control blood pressure control. Number 7. Carrots. Carrots are a very nutritious root vegetable that contains many phenolic compounds, such as caffeic, p-coumaric and chlorogenic acid. These compounds relax blood vessels, reduce inflammation, and lower high blood pressure. Although carrots can be cooked or eaten raw, experts recommend eating them raw or juiced to reduce high blood pressure. In addition, drinking 473 milliliters of fresh carrot juice daily for 3 months may help reduce systolic blood pressure levels, but has no significant impact on diastolic blood pressure. Number 8. Dark green leafy vegetables. Foods rich in potassium will help your body achieve a higher ratio of potassium to sodium, thus helping to neutralize sodium in the body. This allows the body to get rid of the sodium in the kidneys through the urine, thus lowering blood pressure. Green leafy vegetables such as lettuce, kale, turnip greens, bok choy, spinach are all very rich in potassium. You should choose fresh, green vegetables because canned vegetables often have added sodium. You can also choose frozen vegetables, because frozen vegetables contain almost as many nutrients as fresh vegetables, and are easy to store. Number 9. Oatmeal. As a food rich in fiber, low in fat and sodium, and very cheap, oatmeal is considered one of the very popular foods for people with high blood pressure. The ideal time to eat oatmeal porridge is in the morning, because oatmeal porridge is not only effective in treating high blood pressure but also an energy supplement for a long active day. Number 10. Citrus fruits like orange, lemon, grapefruit. Citrus fruits, including grapefruit, oranges, and lemons, may have a blood pressure lowering effect. They contain many vitamins, minerals and plant compounds that can help keep your heart healthy. Blood pressure is not increased. A 5-month study with 101 Japanese women demonstrated that daily lemonade combined with walking can reduce blood pressure. Studies have also shown that drinking orange and grapefruit juice can help lower blood pressure. However, grapefruit and grapefruit juice can interfere with common blood pressure lowering medications. So you can consult with your doctor before adding grapefruit to your diet. Number 11. Potatoes. Potatoes contain two minerals, potassium and magnesium, that help lower blood pressure. At the same time, potatoes are rich in fiber, which is essential in the diet of every meal of your family. Enjoy a baked potato as a main dish at dinner instead of eating foods containing butter, salt, sour cream with yogurt or hot sauce dishes. Number 12. Sugar-free milk, skim milk, yogurt. Not all milk is good for people with high blood pressure. Sugar-free milk and skim milk are all formulated with reasonable nutritional ingredients, rich in calcium, and low in fat. Many studies have shown that women who consume yogurt at least 5 times a week can reduce their risk of high blood pressure by 20%. Two important factors in the diet of people with hypertension are calcium and low-fat foods. Therefore, yogurt and skim milk are the perfect choice for people with high blood pressure. According to the American Heart Association, a daily serving of yogurt can reduce the risk of hypertension. Number 13. Lentils and other beans. Lentils are a staple of many diets around the world due to being an excellent vegetarian source of protein and fiber. In 2014, researchers who studied the effects of a diet rich in legumes on rats reported reduced levels of blood pressure and cholesterol. A total of 30% of the rats' diet consisted of legumes including peas, lentils and chickpeas. Lentils can be used for many dishes. Many people use them as a vegetarian alternative to minced beef or eat with salads, stews and soups. Number 14. Watermelon. Watermelon contains an amino acid called citrulline, which may help control high blood pressure. Citrulline helps the body produce nitric oxide, which relaxes blood vessels and encourages flexibility of the arteries. These effects help with blood circulation. In one study, adults with obesity and pre-hypertension or mild hypertension who took watermelon extract showed decreased blood pressure in the ankles and brachial arteries. Hopefully the video has helped you answer the question, what should I eat for high blood pressure? To diversify daily menu for high blood pressure patients,